He hasn't had any
My
surgery.
man knows what he's doing.
And
I've
we're
been
gonna
coming to him for 5 years. 5.
Only 5?
Only
Okay.
5.
All right.
Best 5 years of my life. He's making me feel young again.
Appreciate
Sometimes
that.
I flare up and it's gone just like that. I wouldn't recommend anybody else.
And he does do, in fairness, he does do some maintenance care, but sometimes he forgets about us, you know. So if you haven't seen your chiropractor lately, give him a call, give him a text, however you contact your chiropractor, and get in the office for a checkup. Hi everyone, Dr. David Kulla here with Jose again. Jose is like our YouTube celebrity. He's been in a few videos. He's all banged up, poor guy. That's what football will do to you, okay? This guy, you can't tell, he's a big guy, linebacker kind of guy, and his neck, he has disc herniations, disc bulges throughout every disc in the neck, just like me. So, he has stenosis, he has arthritis, osteophytes forming. I don't have too much in the way of arthritis as much as him. But I'm going to show you a really great solution for people that have disc herniations throughout their neck and have a lot of neck pain. From time to time, he gets really severe flare-ups, and then I don't see him for... I'll see him, we'll get him through it, and then I don't see him sometimes for a couple months, and then he's back in sometimes. So what we've done in the past is chiropractic, coxflexion distraction, traction, spinal decompression for his neck, and it's worked really well. But now I think to reduce the reoccurrences, we're going to step it up a little bit here, and we're going to start doing cold laser therapy here on him. So this is the magic bullet. Cold laser therapy not only reduces inflammation all around those osteophytes, all around that arthritis, it's going to reduce all the inflammation around the nerve roots. It's going to heal and repair the soft tissue. And trust me, with all that inflammation, with all that arthritis and disc damage, there is soft tissue damage as well, okay? So we're going to go ahead and sandwich his neck with the Multi-Radiance MR5 Active Pro. This has laser stim, so I can find areas of inflammation with this one. And then we've got a little bit of an older model right here, the TerraQuant, and we're going to go ahead and start there. So he can't even tuck his chin down, right? That's painful for you?
Very painful.
Okay. Yeah, he's not his usual self. He's usually coming in here cracking jokes, and he's not doing that today. So I know he's in some discomfort. So again, this has been common, and this is common with people that have disc herniations in the neck or arthritis in the neck. It's very common to see these flare-ups come out of the blue, no reason, no rhyme or reason, just maybe slept that way, or and he doesn't know how he aggravated his neck. But I do recommend that if you do have multiple disc herniations in the neck, that you find a great chiropractor, and
like
thank you, appreciate that, and or a physical therapist and a chiropractor, because the PT can't do what the chiropractor can do, it doesn't replace the adjustments, but they can certainly work on soft tissue. Not all chiropractors work on soft tissue much, so you got to find the right one for you. But keep them on speed dial and do maintenance care, kind of like what you do for your teeth, where you get your teeth cleaned every day, I hope, twice a day. But you're also going to the dentist twice a year for a cleaning, and most of us don't do anything for our neck and our spine every day, let alone go to the chiropractor twice a year even. A lot of people don't do that. So start thinking of it along those lines. If you have a weakness in your spine, then you need to take a little bit extra TLC. Give it a little love, that's all. And if you have a kid that plays football, tell him to stop tackling with his head.
Down, yeah.
Wrap them up, no tackling with the head anymore. I know they're teaching that now, how to
heads up.
Yeah, but it certainly took long enough, and I don't know. I probably wouldn't even have my kid play football until at least till his teens, if possible. But
right.
You all right there?
Yeah.
So, you know, folks, you're watching this. You're not seeing much. There's red light that comes out of this. I'm not wearing glasses because I'm not looking. There's no light leaking out. I have it right to his skin. But yes, they typically tell you to wear glasses. This laser here is a class 1A. So it's not dangerous unless you shine it right in your eye, which we're not going to do that, obviously. And we're going to do a series of 10 to 15 laser treatments on him. I already know what the results are, and I'm going to tell you guys, it's a game changer. I have every disc in my neck herniated. I went into a windshield of a car. I was in car accidents. I had a bike wreck last year, hit my head hard. I had another MRI done. I have stenosis in my neck. I even had a little bit of weakness into my arm, right? So it can affect the nerves that control sensation in the arms. So tingling or numbness in the hands, arms, or fingers. He's had that. Do you have that now?
No.
Okay. So he's had that before. At least he doesn't have that. And then it can create weakness in the muscles because those nerves control, the motor nerves control the muscles. And that's what I have. So chiropractic was huge for me. It helped me get through about 60 to 70% of what I was dealing with. But there was still some other stuff after my last accident, headaches and things that, although it was helping 60 to 70%, I needed more. And that's where the laser really changed everything for me. So I know it is for you. If any of you out there suffer from disc herniations and you're considering surgery, please hold off on surgery. Try cold laser therapy. You got to do it at least 3 times a week for at least 3 weeks. And speak up to the doctor. If it's not improving after a week or 2, then maybe he has to change the frequency or the hertz, or, you know. So just make sure you give it a fair shake. It's really effective for most people. There are a small subset of people that seem not to benefit from it. And those people could be on like non-steroidal anti-inflammatories. So you don't want to be on like ibuprofen or naproxen or something like Advil like that while you're doing laser. It's just going to negate the effect of the laser. So you want to get off the NSAIDs before you start a course of treatment of laser. And you also want to know what's working. You don't want to take painkillers and anti-inflammatories while you're doing a course of laser treatment. And again, at least 10 to 15 before you write it off completely. Okay. Now, a little while ago, he was not able to tuck his chin down. So we're gonna check that here in a minute. How you doing there, buddy?
Hanging in there.
All right. Of course, you come to me on a Friday, right? So he comes in. He you know, we do take appointments, but he walks in, and luckily we were able to see him today. But he comes in on a Friday when we're closed for the rest of the weekend. If you could zoom in on my face right now.
My bad.
It's all right. I'm not. You know the drill. I'm not gonna lecture you on it. I wish you would come in more for maintenance once in a while. You know, I haven't seen him in a couple months. When was the last time I saw you? Your last episode was your lower back.
Yeah, that was 2 months.
Which he has herniations in his lower back. So, people, take care of your spines. Sports are great and all, but just be aware of what you're doing to your body, you young folks, huh?
Yep.
When we're young, we don't think about that stuff.
Yep.
Okay, I want you to go ahead and try and tuck your chin now. We haven't even adjusted you or anything, just did laser. Drop it down in the thing and then tuck it. Is it easier?
Yeah.
Okay. We're still, I need you to turn over on your back. Now we're gonna laser the front. And this is the best way to laser the neck because it gets right to the discs. Through the front is easier, actually. Less tissue and bone to get through. Can I extend it back, actually? Is that better for you?
Yeah.
It's better for me, actually. Okay. So he's no offense, Jose, I've known him a long time, so I know he's not gonna swing at me here. He's got no neck.
Yeah.
So, there's not a lot of room. This laser, the treatment's quick because he has a short neck, right? How tall are you?
5'9".
5'9", okay. But we certainly have a lot of soft tissue. So he's got a short, thick neck, right? So I use different frequencies to penetrate different depths into the tissue. So for him, I went a little deeper. I have 500 hertz right now, just to penetrate a little bit deeper through the soft tissue and get right into the disc, the spine, the nerve where it exits from the spine. And then you'll be able to tuck your chin even more after this, okay? Mm-hmm. So not all doctors do cold lasers. Sometimes they do it and they don't do a good job of it, unfortunately. We have rental lasers we offer for people in the area locally. There might be some other doctors that do that. I hope by now, since COVID, there are some. But if you don't want to do that, I would just go and try it out for at least, I would say at least 6 to 9 sessions. But make sure you're doing several in a row, at minimum 3 times a week. And if the doctor tells you only need it once a week, then he probably is not the laser guy that you want to see. Meaning he's probably maybe not well versed in laser. It's not something you would do once a week if you're coming in there for an acute problem, for a severe problem like that. So, all right, keep those eyes closed. Good. So we're gonna go ahead and follow up here again with the adjustment, soft tissue work. And normally we would do traction, but something I wanna explain, yes, traction is for somebody with a disc herniation, but it's really for somebody that has radicular symptoms, meaning symptoms down into the arms, hands, or fingers, or if you were having a low back issue, into the legs and feet and toes. So numbness or tingling or pain shooting down the arm, then traction would be warranted. But if you're not having those symptoms, traction is not always the best thing to do, just because you have a disc herniation. So we're treating those discs right now with laser therapy. So we don't need to do traction as much today. That's not as important because, again, I asked him if he was having any symptoms into his arms, hands, and fingers, and he's not. Go ahead, sit up, face the camera, and tuck your chin, see how that feels. Just move your neck around. We haven't even adjusted you yet.
Wow, look at that. Look at that.
Is it better?
A lot better. I couldn't do this when I walked in.
Okay, you hear that? Couldn't do that when he walked in. We should have showed you his range of motion when he walked in, but it wasn't good. So we're gonna go ahead and finish adjusting you. Lay on your stomach, big guy. So there are a lot of ways to loosen up soft tissue. He does have a forward head posture, so that's something we've worked on with him. We've given him some exercises. How are you doing with the exercises, by the way? The chin tucks and...
Chin tucks and the ball.
Yeah.
Yeah, I'm doing good.
Okay, probably can't do it right now because you've had a little flare-up, but you can definitely get back to that maybe next week.
Definitely.
Okay, take a deep breath in. A lot of ways to do soft tissue. There's Graston technique. There's this. There's cupping. There's ART. We do a mixture of all these different therapies. Some work better for others. It just depends on what the condition is. Do you have a foam roller? Do you have a foam roller at home?
The blue one?
Yeah.
Yeah.
You need to use that a little more. You're a little hunched right there, okay?
Oh, yeah?
Yeah. A little bit, right through here. Okay, turn over on your back. Yeah, he's normally cracking jokes by now, so I can tell you're not yourself today. All right, let's get you back to yourself for this weekend. All right, tuck your chin down. Take a deep breath in. Able to tuck that chin okay?
A little bit.
All right, relax here. It's going to be easier after that adjustment. And deep breath, yep. And blow out. Good, relax. And slide up towards the head of the table. When adjusting somebody with osteophytes, you want to be careful. You want to know where the osteophytes are. We've taken x-rays of his neck and have MRIs and everything. Depending on where the osteophytes are, that could create some problems and can cause a flare-up if not adjusted properly. So make sure you get some x-rays done, or at least if you have, bring them over to your chiropractor's office Tender right there.
Yes, sir.
Relax here. Have you just been doing the chin tuck or the other ones that I gave you?
The chin tuck and a roll with the ball, laying on the floor and sleeping on a dental roll.
Okay. Yeah, so we gave him a dental roll, which is like an orthotic for the neck. You lay on top of it to get that curve back in the neck. Do you sleep with a good pillow?
Yeah.
Okay. All right, sit up.
A flat one.
A flat one?
Yeah.
No support under your neck.
No.
Spin to the side, towards the camera. Yep, turn your neck left, right. Tuck the chin. Tell me how that feels. A little limited to the right there still. Touch your collarbone over here. No, with your chin. Down. Touch your collarbone with the bottom of your chin. Okay, and this side. Okay, and relax. All right, what I want you to do is bend your head to the left. Yep, pull away from me. Good. You're gonna pull away here. So what we're doing, folks, right now, in case you're wondering, is ART, active release technique. Okay, go ahead again.
Oh, you told me that to hold the chair.
Yeah, and away. Yeah, that's not quite an ART, but you can do this on your own with your other hand, with this hand. Yeah. But go ahead and tilt to this side. Nope, to this side. Yep, and then pull away. Again, this is ART if you're watching this. So we used this gun here, which deregulates the muscle using vibration. Now I'm doing a pin and stretch, which is again called ART, active release technique, and then away, and then towards this side. Yep. And away. And we did cold laser therapy. So we did quite a bit of soft tissue stuff for him today because it's more soft tissue what's going on with him because he had a difficult time moving his head. That's what I knew right away, right? If he came in with my pain shooting down his arm or numbness, his whole hand or finger was numb, away again, then I would know that it's probably more neurological, the disc flared up or something like that. But this might be more the arthritis and the tension in the muscles, and more soft tissue involved here, okay? He had some subluxations in his neck, but it wasn't that bad today. Go ahead to this side now. Nope, to this side, yep, and away. Good. Okay, and the other side, yep. So when people come in with headaches, for example, what do you think? So you would think, okay, would that be neurological, disc, or is that more muscle, musculoskeletal? And the answer to that is 90% of them are musculoskeletal, not neurological. So they'll give you all sorts of neurological pills for your migraine headaches, but 90% of headaches are tension-related headaches. Go away, yep, good. Good, and hold it, hold it, hold it. It's intense, right?
It's great.
And back to this side again. No, all the way to this side. No, you want to bring your ear to your shoulder. Good, and away. Away, good. Good. Okay, now turn your head right and left. Tuck your chin. Now your range of motion is more normal. I want you to stay off your phone for 2 hours. Okay? All right.
Oh, man.
All right, folks. If you have disc herniations in your neck, you're going to have flare-ups. It happens. I get them from time to time. If you've never tried cold laser therapy and you're really considering surgery, I tell you, please don't do that just yet. Try cold laser therapy. Give it a fair shake before you go and you get any kind of surgery. He hasn't had any surgery.
My man knows what he's doing.
And
I've been coming to him for 5 years. 5.
Only 5?
Only 5.
All right.
Best 5 years of my life. He's making me feel young again. Sometimes I flare up and it's gone just like that. I wouldn't recommend anybody else.
And he does do, in fairness, he does do some maintenance care, but sometimes he forgets about us, So if you haven't seen your chiropractor lately, give him a call, give him a text, however you contact your chiropractor, and get in the office for a checkup. Thanks for tubing in.
Thanks. I can't thank you enough. Thanks.
I appreciate it. All right. You're welcome, buddy. Have a good weekend, all right?
Take care.
Okay. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.